Hello everyone, I will talk today about the European examination in core cardiology, how to prepare
Starting
this
exam
with
and how to pass
eligibility
it.
criteria to take this exam. You should be practicing cardiology in one of these countries. For the full list, check this link. Regarding the basic exam information, exam date held once per year. The next one expected to be at 18th of June 2024. Exam registration done through your national society, not in personal manner. Exam fees around 400 euro. The exam consists of 120 MCQ question delivered over 3 hours online through a proctoring platform called ProctorU. You will receive a link to book a slot in this website ahead of exam date. Regarding the exam registration process, usually the announcement by the EECC for this exam done in January, and you have a time window between January and deadline of 1st of March to register through your national society. Then by the middle of March you will receive an email from EECC contain the preparatory course for this exam, as I will show in the coming slides, and you will be asked to book a time slot on the ProctorU website and create account for taking examination. And as I said, the next exam will be at 18th of June 2024. Regarding the exam resources, starting with the ESC Guidelines, and this is the expected updated and new guidelines during this year. What to focus on? Start with the PowerPoint slides. Then the diagnostic and management algorithm is very important. What is the first line? What is the second line? What is the first step and next step in investigation? Is the field of questions. And finally, guidelines full text reading if you have time. The second important source is the free preparatory course that will be sent to you via emails by the middle of March. You will have access to this platform. As shown here, it contains multiple modules covering all field of cardiology, and by the end of this modules you will have a mock exam 1 month ahead of the exam date. What this platform contain? It contain links to the corresponding EECC textbook chapters related to the topic, the guidelines related to this topic, important papers related to this topic, the EECC Congress presentation related to this topic, including the guideline presentation, and finally some miscellaneous webinars covering the topic. What to focus in this long course? My advice is to focus in the short EECC Congress lecture, which is between 10 and 20 minutes. Avoid long webinars that is beyond 1 hour duration. The next important resource to focus in this course is the EECC Guidelines presentation. Each guideline is illustrated in about 1 hour and covering all important points in the corresponding guidelines, and this is an important thing to watch in this course. And third thing and important thing is the imaging section in this course, because about 50% of the exam question contain either ECG, CT, MRI, angio, or MBI picture, TE, transthoracic echo. Anything related to imaging is important. And here's an example of the miscellaneous section that might not found this algorithm in the guidelines, but this algorithm is very important source of exam question. What is the normal ECG finding in athlete, and what is the abnormal, and when to further investigate. The third source is the British Junior Cardiologist Association preparatory course. You will have complimentary free access for this nice course upon exam registration. You will have an email by username and password for this course, and each topic is covered in less than 1 hour. Optional resources is the ECC textbook chapters. You will have complimentary free access upon exam registration for the full text of ECC textbook, but this resource is optional only if you want to get more in depth in selected topics that you are deficient in. And you are invited also to check some videos related to guidelines in my channel in difficult topics like cardio-oncology and pericardial disease. Importantly is MCQ practicing, and the recommended question bank is Study PRN question bank. It contained around 600 questions. It is not directly related to the same exam question, but if you pass this question bank at ease, you will pass the exam at ease also. And there is a sample from this question bank. The second question bank is the MCQ revision videos from the British Junior Cardiologist Association, and as I said before, you will have complimentary free access upon exam registration for this videos, and some of these MCQ came in my exam. The third source is the mock exam. You will have access for this mock exam 1 month ahead of the exam date through the preparatory course platform, and some question also present in my exam. Regarding the level of questions in the exam, 40% of questions are direct questions. The source of this question are the ECC guidelines slides studying. 20% have moderate difficulty, and you can pass this moderate difficulty question through the EECC and the British Junior Cardiologist Association preparatory course videos. Another 20% are deemed difficult, and you can answer them if you done enough MCQ practicing through question bank like Study PRN and the British Junior Cardiology Association MCQ revision videos. Remaining 20% question are very tricky question, depending in depth knowledge of the guidelines, and need guidelines full text studying and many ECG and imaging practice. But the good news is that you only need to pass this exam. The pass mark is around 60%. So if you study the ESC guidelines slides and the preparatory course, you will have this 60%. And if you study MCQ through the question banks, you will have another 20%. So you will pass at ease through these 3 resources. If you want a score in this exam, so study the full text guidelines and practice imaging more and more. Regarding the topics distribution in my exam, you can appreciate that around 50% of exam topics come from these 5 guidelines: heart failure, valvular endocarditis, chronic coronary syndrome, acute coronary syndrome, and VT and sudden cardiac death guidelines cover around 50% of exam question. That's because many of these guidelines contain different imaging modalities: coronary angio, CT, dobutamine, echo, MBI, MRI, PET scan. So as I said before, around 50% of questions contain imaging. The rest of topics are represented as shown here. What to focus on in the guideline according to my exam question. Starting with the heart failure guidelines. Starting from basic thing like heart failure diagnosis. What is the most specific sign of heart failure? Most specific sign of heart failure. I remember exam question in this field. The algorithm of heart failure diagnosis, remember that BNP come before echo, and this an area of question. BNP differential diagnosis, what increase it and what decrease it, this is another question. Heart failure treatment sequencing in different scenario, in a patient with low blood pressure, in a patient with low heart rate, in a congested patient, in a dry patient, and what is the indication for iron therapy, device therapy. All these are covered in the exam question. Acute heart failure workup and treatment according to hemodynamic status, when to use inotropes, when to use nitrates, and so on, and how to monitor diuretic response and how to manage diuretic resistance. Hyperkalemia in heart failure, and when to stop MRA, when to stop ACE or ARBs. Heart failure with recovered ejection fraction management, how to follow this cohort of patient. And remember that don't stop treatment even if ejection fraction recovered, because 50% have relapse after stopping treatment. The only treatment that you can stop is diuretic if the patient is asymptomatic, and this is also covered in my exam. HFpEF diagnosis algorithm, role of exercise in diagnosis of HFpEF. The treatment choice between limited choices are sodium glucose transporter 2 inhibitors, the novel treatment, and the ARNI cutoff points if ejection fraction below 57%, as shown in the Paragon HF trial, and this is also covered in my exam. Heart failure transplantation and lipid indication, contraindication, and complication. I have 2 or 3 questions in my exam in this area. Temporary mechanical supported choice in some patient like cardio-oncology patient with myocarditis, or patient with permanent myocarditis, and the ECMO will give better support than intra-aortic balloon. Myocarditis diagnosis, this is an area of imaging question, CMR picture, and what is the management of this patient. Amyloidosis type and diagnosis algorithm. Imaging question also here, covering the longitudinal strain imaging with a cherry top characteristic picture of amyloidosis. Cardiac MRI picture of amyloidosis with difficulty 1 nulling. Management of this patient. All these topics are covered in my exam. Moving to the valvular guidelines. Timing of surgery in asymptomatic patient. I have bunch of questions covering this area, so you should study the indications of surgery in asymptomatic patients carefully. Rule of exercise in asymptomatic aortic stenosis, mitral stenosis, this is also covered. Low gradient aortic stenosis in different scenario, paradoxical low flow, low gradient, low flow, low gradient with impaired ejection fraction, the role of dobutamine, role of calcium score, role of projected aortic valve area, and management of such patient. All this covered in my exam. TAVR versus SAVR, when to go for H1. Mitral clip indications. Assessment of valve severity in multivalvular heart disease, this is also exam question. Prosthetic valve choice, when to go for tissue, when to go for metallic, and our target in H1. And imaging of prosthetic valve by transthoracic TE 3D echo. I have a question in this area in my exam. Prosthetic valve dysfunction, valve thrombosis management. Tricuspid valve intervention indication, especially in asymptomatic patient. Calcific mitral stenosis assessment. Rheumatic fever diagnosis, prophylaxis, and management. All these points were covered in my exam. Endocarditis guidelines, which patient need prophylaxis, multiple question around this area. Diagnostic criteria by imaging, transthoracic, transesophageal echo showing agitation, empirical regimens of treatment. Timing and indication of surgery is very important. Culture negative endocarditis, cause and management. Prognostic factors in endocarditis. Implantable devices endocarditis, how to manage. Remember that you should remove all the hardware, leads, and pacemaker battery, not just the battery, or not just antibiotic. Special scenario, a patient with endocarditis with recent stroke, recent cerebral hemorrhage, how to manage operation timing in this scenario. Mimics of endocarditis, marantic Liebman-Sack endocarditis. This is also a field of imaging question. Moving into aorta peripheral guidelines. The timing of intervention in thoracic abdominal aneurysm, aortic abdominal aneurysm in a normal patient, in a bicuspid patient, and in Marfan. This contain a very tricky question. Remember that the cutoff points of operating a Marfan patient who have progressive enlargement in his ascending aorta is more than 3 millimeter, not more than or equal. So if you have a patient with only 3 millimeter, this is not an indication of surgery. This is also a field of question. Aortic dissection diagnosis, this is also a question. Rupture coronary sinus of valsalva presentation, vasculitis including Takayasu, antiplatelet in TIA, antiplatelet in symptomatic and asymptomatic peripheral arterial disease. What is the indications? Indications for carotid intervention, when to go for surgery, when to go for stenting, is also a field of question. Moving to the chronic coronary syndrome guidelines, focusing on the pretest probability and risk stratification modality choice, when to go for CT, when to go for MBI or dobutamine echo, when to go for invasive risk stratification. Imaging interpretation, this is a field of multiple imaging question, dobutamine echo, MBI, CMR, perfusion, MBI artifacts. Choice of anti-angina, what is the first line, what is the second lines, and what is the proper anti-angina special scenario, like in a hypotensive patient or in bradycardic patient, in prinzmetal angina, in a patient with bridge. Indication for angiography and revascularization, when to go for PCI, when to go for CABG. Lead misplacement ECG. Acute coronary syndrome guidelines covering the STEMI and non-STEMI 1 and the antiplatelet consensus. Covering STEMI equivalent diagnosis, and here is a field of ECG question like Wellen left bundle Scarposa criteria, De Winter sign, left main equivalent ECG. Antiplatelet management in different scenario, high bleeding risk patient, preoperative management of antiplatelets, the duration of antiplatelet, and what is the least duration where we can stop or shift to less potent one. Management of antiplatelet in a patient needing oral anticoagulation, like a patient with LV thrombus or AF patient. MI complication like VSR, rupture, free wall rupture, arrhythmias managements. Time frames for choice of treatment strategy between primary PCI versus lytic or pharmacoinvasive therapy. This is important. Minuca workup, and here is a field for cardiac MRI question. Mimics of Minuca like Takotsuba, and here is also a question. Spontaneous coronary artery dissection, imaging, angio picture, and management. You should be familiar with this issue. Timing and indication of ICD post-myocardial infarction. Moving to ventricular tachycardia and sudden cardiac death guidelines, important topics. ICD indication different scenarios in different channelopathy or cardiomyopathy patients. Long QT diagnosis, is an ECG question, and management. Remember the propranolol is the beta blocker of choice. Catecholominergic polymorphic VTAC diagnosis, here is an ECG question and management question. Fascicular VT and RVT tachycardia, here is an ECG question and management. BBC management, when to go for ablation in asymptomatic patient or in a patient with BBC-induced cardiomyopathy. Brugada syndrome diagnosis, and here is an ECG question and sports management of such patient and ICD indications. Early repolarization syndrome and management. ARPC diagnosis, and here is a field for ECG and cardiac MRI question. Sports management of such patient. Remember, this patient should avoid competitive sport even if genopositive and phenonegative. And management of such patient, indication for ICD. Sarcoidosis diagnosis, and here is a field for imaging question. Remember, cardiac MRI is most sensitive for diagnosis, but PET scan is better to check for activity. And remember, ICD indication of such patient. Cause and workup for a patient of sudden cardiac death who resuscitated, and sudden cardiac death victims when to go for family screening, and what is the algorithm for family screening, VTAC storm management, ICD appropriate versus inappropriate shock, and here is an ECG or tracing question. Then SVT and AF guidelines. What is the first option in the treatment of AVNRT, AVRT? Remember to read the guidelines algorithm carefully. What is the first, what's the next? Posture orthostatic tachycardia syndrome diagnosis and management, WBW risk stratification and management, pre-excited AF diagnosis, and there is an ECG question, and what is the proper management in acute and long-term situation. Intracardiac tracing of SVT, this is an odd question. Proper choice of rhythm control drug in different scenario, in ischemic patient, in a healthy patient, and in cardiomyopathy patient, in a HOCM patient. Indication for AF ablation and complication of pulmonary vein isolation. AF in heart failure and CRT patient, when to go for ablation. Anticoagulation indications, Shadwas score has bleeding scores, and bleeding management antidotes. Then pacing syncope guidelines. Heart block ECG, this is a field of multiple tracing ECG question, MOBIS type 1, type 2, complete heart block, and what is the indication for pacing. Syncope in elderly versus fall, and what is the first investigation. Bifascicular block with syncope, what is the management. Indication for pacing in reflex syncope, pacing option in heart failure with AV block, when to go for CRT. MRI safety in different cardiac electronic device, including loop recorder. Pacemaker troubleshooting, and there is a field of ECG question. Complication in the short term and long term, like cardiomyopathy. And when to return for driving, there's also a potential question. Moving to pulmonary hypertension and pulmonary embolism guidelines. What is the indication of latex therapy and percutaneous option in pulmonary embolism patient? Risk stratification of such patient. Choice of anticoagulation and different regimen. When to go for heparin, when to go for low molecular weight heparin, when to go for NOAC. Indication for IVC filter. Screening algorithm for CTF is very important. What is the risk factor for CTF? This is important question. Pulmonary hypertension types definition, pre-capillary versus post-capillary, and the hemodynamic tracing to identify if this patient pre or post-capillary. Risk stratification strata, and management of pH, drug sequencing. Moving to GUCH and pregnancy guidelines. What is the indication of percutaneous closure, VT, ACD, PDA, and there is an imaging question also. Indication of intervention in pulmonary stenosis. Tetralogy of complications, management of pulmonary regurgitation. What is the indication of melody valve implantation. Coronary anomaly, and this is a field of imaging question. When to go for surgery, what is the risk stratification of such a patient, role of exercise, stress, and management of such a patient. Fontaine and its complications, Eisenmenger syndrome and the complications, anticoagulation during pregnancy, contraindication of pregnancy in different cardiac patients. Remember WHO 3 and 4 classes, you should memorize them. And what is the mode of delivery of a choice in such a patient. Endocarditis prophylaxis in GUCH patient, what is the indication. Differential diagnosis of dilated RV, and there is a field for imaging question. Management of arrhythmia during pregnancy, drug safety, DC shock safety, valvular heart disease, and hypertension in pregnancy. What is the cutoff points of where you should start the treatment of such patients. Moving to perioperative guidelines. Perioperative drug management, including SGL2 inhibitor, ACE inhibitor, oral anticoagulation, antiplatelet. Perioperative, especially in patient with acute coronary syndrome, in patient with high ischemic risk, in patient with high bleeding risk. Oral anticoagulation, when to bridge and how. NOAC management perioperative. Indication for preoperative stress imaging and angiography. Indication for preoperative revascularization. Asymptomatic valvular heart disease management in the preoperative period. Moving to cardio-oncology guidelines. How to prevent cardiotoxicity, how to survey this patient, and when to hold treatment if the patient developed which grade of cardiotoxicity. Long-term follow-up plan of these patients. Immune checkpoint inhibitor and TCART myocarditis management and diagnosis. Arrhythmia side effect, ibrutinib, for example, is famous for atrial fibrillation. 5-fluorouracil is famous for coronary spasm. Radiotherapy and management of electronic device in a patient needing radiotherapy. Cardiac tumors, malignant and benign one like myxoma, and here is a field of imaging question. Role of PET scan CMR in cardiac masses, and here is a field of imaging question. Dyslipidemia, diabetes and prevention guidelines. The three of these guidelines represent less than 5% of the exam question. LDL target in different subsets. Role of non-statin therapy when to go for second line drug like ezetimibe and third line drug like PCSK9. Statin intolerance management. Statin special situation like heart failure and hemodialysis patients. Familial hypercholesterolemia diagnosis and role of genetic screening. Lipoprotein little a, its importance and when to screen and how to manage. Risk stratification using the score 2 and score 2 OP risk score and when to calculate. Role of ACE, aspirin, SGL2 inhibitor, colchicine for primary prevention. Sports and HOCM guidelines. HCM risk assessment and risk calculation. HCM imaging is a field of echo or CMR question. ICD indications. Sports in HCM. ECG changes in athlete is very important and when to further investigate. Exercise return post pericarditis and myocarditis in athlete. Management of athlete with leg gadolinium enhancement, cardiac MRI, when to go for further investigation, when to return to play. Exercise prescription in different valvular, heart failure, ischemic heart disease and to congenital patients. Moving to pericardial and hypertension guidelines, both representing less than 5%. Pericarditis diagnosis, and here is a field of imaging question like cardiac MRI or ECG. Treatment regimen and duration. Chronic refractory pericarditis management. Pericardial effusion management and timing of serial echo follow-up. Constrictive pericarditis diagnosis, and here is a field of cardiac MRI and hemodynamic tracing question and what is the management. Cardiac tamponade diagnosis, and there is a field of echo and hemodynamic tracing question. Hypertension definition, stages, when to treat and when to combine therapy. Resistant hypertension, workup and management. Secondary hypertension, causes and workup. Hypertension emergency workup and management. Final tips. Try to make your own summary for important guidelines recommendation and important tips from the preparatory courses in your own notebook. Try to make MCQ key points as a bullet in your notebook. This will save much time during your revision. At least 50% of questions contain imaging like transthoracic echo, transesophageal echo, cardiac MRI, CT, beta scan, MBI or ECG, which may contain a clue for the MCQ answer. So try to focus on imaging section and the ECG section in the preparatory course. And finally, best of luck for everyone. Thank you.